Hello and welcome to the Parkinson's Foundation's webinar for Getting to Know Medicare. The Parkinson's Foundation is a nonprofit focused on bettering the lives of those living with Parkinson's through improving care and advancing research. Importantly, everything we do is in close concert with our community to ensure that our actions are aligned with the needs and priorities of those living with and impacted by Parkinson's disease. Today, we will hope to demystify Medicare. Our speaker, Renee Harberts, will help individuals understand health insurance and Medicare in simple, plain terms. Having more information will help you to make informed decisions about your Medicare plans. To begin our formal presentation, I would like to introduce today's moderator. Jim Morgan was diagnosed with early onset Parkinson's disease in 2006. Soon after, he began serving in Parkinson's Foundation roles from Moving Day Miami chairman to co-chair of the Volunteer Leadership Summit and a development committee member. Jim also serves as a member of the Foundation's National Board of Directors. Jim works with numerous charitable organizations. He is the vice chairman of the board of directors of Branches, Inc. He's also volunteered with the Miami Lighthouse for the Blind, the St. Thomas Episcopal Parish School Board, and United Way of Miami-Dade County. For more than 30 years, he has been an active member of the First United Methodist Church of Coral Gables, where he currently serves as the chairman of the Board of Trustees. He was awarded the South Florida Business Journal's Up in Corners Award, and until his retirement in 2021, was recognized among the best lawyers in America and Florida super lawyers. In 2019, Jim was recognized as one of the Ronald McDonald House Charity's 12 Good Men and received the United Way of Miami-Dade County's Dorothy Shula Award for Outstanding Volunteerism. Jim received his law degree from Nova Southeastern University. Jim, the Foundation is overwhelmingly grateful for your commitment and dedication you have in serving our community. Thank you for all that you do.
Well, Krista, thank you for that. And as Krista mentioned, I personally have been living with Parkinson's disease for the last 18 years. You know, when I was diagnosed, I really had no idea what Parkinson's disease was, or even knew anyone who had it. But shortly after my diagnosis, I was introduced to the Parkinson's Foundation. It was that early introduction to the Parkinson's Foundation and their vast resources of information and support, as well as an incredible community of like-minded people, that really attracted me to the Parkinson's Foundation. While there are many great organizations serving the Parkinson's community, it's the Parkinson's Foundation's mission to make life better today for people living with Parkinson's, all while advancing research towards a cure, that really resonates with me. Parkinson's Foundation indeed makes life better every day for people living with Parkinson's and those who love and care for them. They can make a difference in your life. They've certainly made a difference in mine. Today, I have the pleasure of introducing our presenter, Renee Harberts. Renee, a Medicare health plan specialist, is a licensed independent insurance broker and a partner at Associated Professionals Limited. She is licensed in Minnesota with the local and national insurance carriers. Renee has worked in the insurance and financial services industries for over 25 years and has specialized in the Medicare insurance industry since 2019. Renee helps individuals understand health insurance and Medicare in simple, plain terms. She believes that if folks have a little more information up front, they will make better decisions about their Medicare plans and make Medicare work better for them or a loved one. With that, I'm pleased to turn it over to Renee Harberts.
Hi Renee, it's Kayla.
Hi.
Are you able to turn on your screen or your video? Sorry. I'm pulling up your PowerPoint right now.
I am thinking that you were going to do that. So
yes, I'm getting your PowerPoint, but if you don't mind turning on your video, for some reason it's not letting me
I'm
turn
sorry.
the video.
That's it. Okay, I'm sorry about that. There we go.
That's okay. There's
There
your
we
beautiful
go.
face.
Well, thank you so much, Jim, for that lovely introduction. And thank you, everybody, for allowing me to share some information with you about my very favorite topic, Medicare. Like Jim said, I'm an independent insurance broker, and it's really my job to educate people about Medicare so that really when it comes time for them to choose a plan, they can be educated and feel confident about the plans that they choose. So having said that, I am going to dive right into my presentation. And you know, Krista, I am not seeing the buttons to move this forward. Oh, sorry.
Just by clicking it, you'll move it forward and back, Renee.
Pardon?
If you just click your mouse, it'll move it forward.
Ah, great, thank you. Well, the first thing I have to do is do a little housekeeping and just say important disclaimers. So this is not an educational session. It is only an offer. It is not an offer of any product or carrier-specific information. I am not affiliated or endorsed by the Department of Health, Human Services, or any government agency. While every effort has been made to make certain that the information is accurate, information changes fast and there could be omissions or errors. This is a broad overview of Medicare, and not every detail about Medicare can be included. We do not offer every plan available in the area. Currently, we represent 9 organizations, which really means insurance companies, and 46 different plans in your area. Please contact medicare.gov or 1-800-MEDICARE to get information on all the products that you need. So our learning objectives, what I hope to accomplish today is that you will come away with a better understanding of Medicare. I'll go over some resources for you to find options and some places where you can find out more about financial aid. We'll go over some pitfalls and some misconceptions about Medicare. And then at the end, we will go through some changes that are coming up for 2025. So now that I kind of have all my housekeeping taken care of, let's dive right in and say, what is Medicare? Well, Medicare is a federal insurance program enacted in 1965, eligible for U.S. citizens and legal residents. It's funded in part with your taxes that you pay while you're working, so your FIC or FICA taxes on your tax stub, on your payroll stub. It is individual insurance. Sometimes I get asked, can I, be with my spouse, or could we have a family plan? It is not. Every person has their own individual insurance plan. Medicare is not free. It is not Social Security, even though you sign up through Social Security. It is not. And it is not Medicaid. Medicaid is a state-run program, and actually in Minnesota, we don't really call it Medicaid. We call it MA, Medical Assistance. So who can get Medicare? U.S. citizens and legal residents. So legal residents must live in the U.S. for at least 5 years in a row, including the 5 years just before applying for Medicare. You need to be age 65 or older. If you are younger than age 65 with a qualifying disability, if you're on Social Security disability, you can qualify for Medicare younger than age 65. If you are any age and diagnosed with end-stage renal disease or ALS, you can qualify for Medicare. I am going to cover this little slide right now about working past age 65 because I get questions about this really, really often. People say, oh, Renee, I want to keep working. Can I delay Medicare? And it really depends. It depends upon 2 things. 1, upon the size of your employer, and 2, if your employer coverage is considered creditable. And creditable really simply means that your Part D, or the Part D on that group insurance, is at least as good as what Medicare's Part D is. So if your employer has 20 employees or more, you can delay your Medicare. You can stay on your group plan. And if it has fewer than 20 employees, you will need to sign up for Medicare. The reason for this is that when you have a plan that has less than 20 employees, Medicare becomes the primary payer, and your group plan would be the secondary payer. And if you don't have a primary payer, the secondary payer doesn't have to pay. And I have heard people say, you know, my group plan says that they're going to pay regardless. And I'm like, okay, if they say that, please make certain you get that in writing and be cautious of that. So just a little heads up on that. If you are covered under a spouse's plan, make certain that you check with the employer's plan and find out what their rules are around covered dependents. And kind of one other important note is that if you take part of any part of Medicare, Part A or Part B, you can no longer contribute to an HSA. There are many rules around this, and I don't have time to go into all those, but just please remember that if you start Medicare, you cannot contribute to your HSA. So now let's dive into what original Medicare really is. So you probably all have heard that there's Parts A and B. And Part A is hospital insurance or inpatient care. Part B is medical insurance or doctor services and outpatient care. So Part A pays for your hospital or inpatient care when you're in a hospital, in a skilled nursing, or in hospice. It is premium free for those who have worked and paid taxes for 10 years or longer. And if you haven't worked, if a spouse has, you would qualify. Coverage cannot be denied. It does not matter what your financial status is or what your health status is. You cannot be denied coverage. It's nationwide. It does have deductibles per benefit period. It does have co-pays for hospital stays and skilled nursing. It does have co-insurance for respite care and durable medical used in your home. So we said Part B is for doctor services. There is a monthly premium for Part B, and it can vary depending upon the taxes that you reported the 2 years prior to your signing up for Medicare. So it is based on a sliding scale, and for 2024, that scale is starting at $170.70 and maxing out at $594. That usually changes every year, kind of goes up a couple dollars every year. There is again, can't be denied coverage, nationwide coverage. There's a penalty for late enrollment unless you have a special enrollment period, which we will talk a little bit more about. Medicare Part B is, I like to call it an 80-20 plan because that's what it is, but Medicare covers 80% of the covered services, and you are responsible, or the beneficiary is responsible for 20% of whatever those costs are. So if you had $1 million expense, you're gonna be responsible for 20% of that. And there's no cap on those expenses. So if there's no max out of pocket, you are just responsible for whatever the bills of 20% are. Having said all of that, we're going to go into a little bit more detail about specifically what a Medicare Part A covers. So we said it's inpatient, so it covers all of your services while you're in the hospital, your room and board, special care units such as intensive care, your prescription drugs that you would get while you're in the hospital, all your lab tests, x-rays, diagnostic, operating room, recovery room. It covers skilled nursing services, blood transfusions, some blood transfusions, hospice care, including the medications used to manage the symptoms of pain. There is coverage under Part A for part-time skilled care for homebound after a qualified inpatient stay, and also for rehabilitative services after a qualified inpatient stay. And just briefly, a qualified inpatient stay means that you have been in the hospital, you are an inpatient, you've been admitted to the hospital for 3 days. If you have not been admitted into the hospital, like if you're in observation status, it is not considered a qualified inpatient stay. So you could actually even be in your room and still be under observation status. So the doctor needs to admit you and the hospital needs to let you know what your status is. And this is important because it will determine in some ways how your benefits moving forward are covered. So part B, we said, was outpatient care doctor services. Doctors, including while you're in the hospital, your annual wellness visit, all your preventative services like flu shots, mammograms, colonoscopies, anything that Medicare deems preventive is covered. Your laboratory services like blood tests, urine tests, all your diagnostic tests, x-rays, MRIs, some health programs like smoking cessation and obesity counseling. Physical therapy is covered under Part B. So physical therapy, occupational therapy, speech and language pathology, that's probably a service that many people with diabetes Parkinson's disease are interested in. So there is coverage for physical and occupational and speech therapy. There's diabetes screening, there's mental health, durable medical, used in home like wheelchairs and walkers. One note about this is a doctor does have to prescribe it, so to speak. They have to say that you need this, it's needed, and you have to purchase it from a Medicare approved vendor. Ambulatory surgery centers are covered under Part B. So lots of times people don't go to the hospital anymore for surgery. They go to a surgery center. That's covered under Part B, along with your ambulance, emergency room, and some telehealth visits. So as you can see, Medicare Parts A and Part B, original Medicare, covers many things, but it does not cover everything. Sometimes people are really surprised to know that Medicare doesn't cover everything. They're like, I want everything covered. It's just kind of not going to happen that way. Services must be considered medically necessary. As I go along, I'll give you a little example of that, but that's an important concept to remember, that Medicare approves services that they deem medically necessary. So it does not cover all the costs of your care. Like we said, there's going to be some out-of-pocket costs. There are co-pays, co-insurances, and deductibles. Medicare does not cover prescription drugs. It does not cover routine dental, vision, and hearing. So if you go in and want to know, do I see 20/20? Medicare does not cover that. It does not cover eyeglasses, contacts, or hearing aids. It does not cover long-term care, custodial care, like help with bathing, eating, dressing, transferring. There is such a thing called excess charges for doctors who don't participate in a Medicare assignment program. So if you were to see a doctor who doesn't agree to Medicare's payment system, they can bill you for excess charges. In Minnesota, that's not allowed. We don't allow excess charges, but if you went to another state, you could end up with excess service charges. There is typically not care outside of the US except for emergency services. Now I'm going to do a clarification on the medically necessary. So I said it didn't cover routine hearing, vision, and dental, but it does cover medically necessary like cataracts, glaucoma, and macular degeneration. And if you went in for a cataract surgery, and when you do that, they put a new lens in your eye. Medicare will cover a basic lens, but if you happen to be someone who has astigmatism, which I have many clients who have astigmatism, they'll put in a specific lens to help correct that astigmatism. Medicare does not consider that lens medically necessary. So you would be responsible if you opted to have that lens. You'd be responsible for the extra cost of that. So I just wanted to let you know that there's sometimes that how Medicare deems things medically necessary might not be the way you and I do. Okay, so extra coverages. This is probably the most important thing that you're going to do when you are considering Medicare. So here are the ways that you can get additional coverage. So you have original Medicare Part A and B. We said that there's costs associated with A, there's costs associated with B. It's an 80-20 plan. So we know we have that. We want more. Option number one, and you guys, this is really where I spend the most of my time when I work with people, is right here, helping people know and understand, because there's many nuances to these two options. This is where I spend my time working with people to make certain that they're really certain of which option that they want to go, because sometimes it's irreversible, the decision. So you have Medicare Part A and B. You can opt to add a prescription drug plan to that. You can opt to pick up a Medicare supplement or a Medigap, same thing. Both of these two additions are provided by private health insurance carriers. Option two is that you could choose to have a Medicare Advantage plan, and those are also oftentimes called Part C. So Part C combines original Medicare's Part A and B, and they usually include the prescription drug coverage. They also offer some additional benefits that original Medicare does not, and they combine all of this into a package and call it Medicare Advantage or Part C. Now I'm going to kind of start to go into the specifics of those options. So I'm going to start with Medicare Advantage. And Medicare Advantage is another way to receive your benefits. It is a alternative to original Medicare. You still are in that program, but the benefits now become administered by the insurance carrier as opposed to Medicare itself. We kind of touched on those, so I'm going to flip to the next. All Medicare Advantage plans have to cover all the benefits of Part A and Part B. Many plans have a prescription drug, some don't. Typically, if they don't, it's because somebody is probably getting their prescription drugs through the VA or another prescription drug plan. We kind of talked about this, that there's extra benefits. So most Medicare Advantage plans will have coverage for routine dental. They will have routine eye exams. They'll have an allowance for eyeglasses or contact lenses. They will have an allowance for hearing aids and hearing tests, and most of them have a fitness program. You must be enrolled in both Medicare Part A and B and live in the planned service area. A planned service area is kind of an interesting concept. A planned service area means that the insurance companies offer a plan. They offer plans in specific areas. For instance, the metro is a service area. The southern part of the state is a service area. The northern part of the state is a service area. And only certain plans get offered in those service areas, and you have to be in that service area to get a plan. Coverage can't be denied based on your financial or health status, including any kind of pre-existing conditions. You may be required to use provider pharmacy networks and not only just pharmacy networks, but the plan could very well have in some plans definitely make you stay within a network. Some plans could have in and out of network. It will cost you more to go out of network. This is an important concept when you're considering, because sometimes, even if your plan says it will pay for in or out of network service, the organization, the provider of a service might say, we don't accept Medicare Advantage plans. So we have that issue with Mayo Clinic does not accept all Medicare Advantage plans. So important thing to check. There will be, all Medicare Advantage plans have to have a max out of pocket, an annual limit, that once you have spent X amount of money, whatever that plan deems, once you've spent, let's say, I don't know, $4,000 for your covered services, you're no longer responsible for any more costs associated with your plan. Medicare Advantage plans may or may not have a premium. There are actually many Medicare Advantage plans that are a zero premium. And actually zero premium plans are very popular, but there's also many of them that do have premiums. And as you can imagine, the more you pay for a premium, the less your costs to use it are going to be. You also must always continue paying your Part B premium to Medicare. That premium never goes away. That surprises people sometimes. Part D prescription drugs, we talked about that you could get that either as a standalone addition to Part A and Part B, or that Medicare Advantage plans include that. Every prescription drug plan, regardless of whether it's a standalone or combined with the Medicare Advantage plan, has a formulary. And a formulary is really just the drugs that are covered in that plan. And every plan has tiers, and then the higher the tier goes, the bigger the cost. So like tier 1 will be your preferred generics, and tier 5 will be your specialty drugs. Most plans have deductibles that are charged by tier. And what I mean by that, some plans might have a deductible starting with tiers 3 through 5. Some plans might have a deductible that starts at tier 1 and goes all the way through tier 5. And some plans might not have a deductible for any tiers, and just you perhaps know, but deductible means the piece that you have to pay, the amount you have to pay before the plan starts paying for your benefits. So you do need to be enrolled in Medicare Part A, Part B, or both. You may be required to use a pharmacy network. More often, what really happens is that you will get better pricing if you use a preferred network or a preferred pharmacy. Most plans actually have a preferred pharmacy. Coverages and costs vary by plan and may change each year. Not only may they change each year, I've never seen the fact that they do not change every year. This is also where I spend a lot of my time, and we'll talk a little bit about it during AEP, but this is the time of year that we check every plan to see what changes have been made for the year. There is a Part D penalty for late enrollment unless you have a special enrollment period qualification, which we'll go into a little bit later. Now we're going to talk here about Medicare supplement or Medigap. Those are known either way. People use the words interchangeably. Medicare supplements and Medigap plans work with original Medicare. And kind of what I mean by that is they follow Medicare A and B exactly. Still remember I said that the Advantage plans are managed by the insurance carrier, or at least I hope I said that. An example of this is a Medicare Advantage plan. When you receive a service, your bill will go to the insurance company. It will not go to original Medicare. It will go to the insurance company that you're with. They will determine your benefits and they will pay your bills. With a Medicare supplement plan, when you have a service, your billing will go to Medicare. They will pay their portion, and the next portion will go to your Medigap carrier. You cannot have a Medicare Advantage and a Medigap plan together. You can't use a Medicare Advantage or a Medigap plan to pay for Medicare Advantage. Another interesting thing is, remember I said that plans change with Medicare Advantage plans. They change by carrier, by plan. They change every year. Medigap plans are standardized. They're federally and state standardized. So if you buy a Medigap plan, and in Minnesota, we kind of have 3 choices. We have a Medigap basic, a basic with riders, and an extended basic. If you purchase a Medicare basic, let's say, with insurance company A, and you buy it with insurance company B, you're going to have the exact same coverages. It doesn't change. That's mandated. And in Minnesota, that's how Minnesota does that. We have the basic, extended basic, basic with riders. We don't have all those letters. If you're going online and you are looking at plans, don't look at those letters because we don't really offer it that way in Minnesota. And these plans are private insurance. Medicare supplement plan does all these things that we kind of talked about. It pays for your hospital coinsurance, skilled nursing coinsurance, your blood transfusions, extra days in the hospital, hospice care, coinsurance, your Part A deductible, Part B deductible. It may or may not. That's a nuance that we could go over if I were talking to you individually. It may cover some emergency travel coverage in addition to just the emergency. I'm sorry, it may cover it in addition to the emergency coverage service. And it does take care of that excess charges that we talked about. So, some interesting facts about Medigap or Medicare supplement. So you must be enrolled in both Medicare Parts A and B. And you must live in the state where the plan is offered, not the specific areas. This is really important, there's no medical underwriting up to 6 months after enrolling in Part B at age 65. So when you first are eligible for Medicare, your initial enrollment period, the first time that you're eligible, is the time when you want to decide if you want a Medigap plan or a Medicare Advantage plan. Because when you're first eligible, you are what is called guaranteed issue. You are guaranteed that you can get into a Medigap plan, no underwriting, no, it doesn't matter what your pre-existing conditions are, you will get guaranteed issue. If you wait for, let's say, maybe you do a Medicare Advantage plan for a couple of years and you say, oh, you know what, I really want to go back to Medigap, you'll have to go through underwriting, and depending upon what kind of medical issues you might have, you very well may not be able to pick up a Medigap plan. And in Minnesota, we're either in or out. Some states will say, oh yeah, you have this diagnosis, we'll charge you more for it, but not Minnesota. Your plans are guaranteed renewable as long as you pay your premiums. Premiums vary for the same coverage. Like I said, if you buy it from one plan, one carrier or the other, the coverage will be the same. Premiums might be different. As with anything else, the more you pay for your premium, the better coverage you get. You must continue to pay your Part B premium. That little bugger never goes away. A really important distinction here with Medigap, Medicare supplement is this is really probably one of the biggest reasons why people choose a Medigap plan is that there's no networks involved. You don't have to get a prior approval from a specialist to use your plan. There are no networks throughout the whole country. So if you travel a bunch, you never have to worry, is my doctor going to be in my network? No networks. I'm not really going to cover too much on this slide because we already did. But one thing, just in a little analysis, when I think of a Medigap plan, I think of it as a pay up front plan. You pay up front, and for the most part, you can mitigate your costs in that plan. So you pay up front. When you go to use it, you'll have probably that one-time yearly deductible depending upon the plan you buy. So you can mitigate your costs. A Medicare Advantage plan, I kind of think of more as a pay-as-you-go. You might pay that zero premium for your plan, but then when you go to use that plan, you're going to have the co-pays, the co-insurances, the deductibles. So just kind of two sort of different ways to think about those plans. This happens to be my favorite graphic. It just shows you really easily your options. So you can have your Medicare Part A and B, you can add a Part D, you can add a Medigap plan. Most people do the bottom one where they add both, or you can do a Medicare Part C, and you can do a Part C with D included, or if you maybe have your D as a VA option, you could just do a C and you have your Part D as a standalone. Medicare costs. So we kind of really talked about that you're always going to have your Part B premium that you're going to have to pay for. Each plan, it will have a premium unless, of course, you do a Medicare Advantage plan that does not have a premium, a zero premium plan. You won't have a premium. You'll have deductibles, co-pays, and co-insurance. So the deductible is the set amount that you pay before your services begin. A co-pay is a fixed amount. You go see your doctor, you have a $10 co-pay, $20 co-pay. Co-insurance is really the percent that your plan splits with you for the costs. I don't think, seeing as how we probably don't have just terribly much time, that I'm going to spend too much on this particular slide. They always really want you to know that every Medicare Advantage plan has a maximum out of pocket. So when can you enroll in Medicare? Well, the first time that most people enroll is called your initial enrollment period. And that is a 7-month window where you have 3 months before your birth month that you turn age 65, and then 3 months after you turn age 65. If you are receiving Social Security or railroad benefits or Social Security disability benefits for 24 months, you will automatically be enrolled. If you are not receiving, if those aren't your situation, you will need to enroll yourself by going to SSA, so socialsecurity.gov, setting up account and enrolling online. You could also visit your office, but my suggestion would be to go online. The Medicare Advantage plans, Part D, Medigap, you would have to enroll directly with a plan provider. The tip over here that says to enroll early to avoid gaps and penalties is super important. So I want to explain to you that if you sign up for Medicare the 3 months prior to your age 65, you can go in and enroll, and you ask to have it begin on your birth month. So all plans begin on the first of the month. Those prior 3 months, if you go in on month 1, it'll start on the birth month that you turn age 65. If you wait until age 65 to sign up, it is not going to start until your plan won't start until the next month. And if you go on 5th month, it won't start until like the 6th month. 6th month, it won't start till 7th, 7th till 8th. So you want to make certain that you have this set up and starting when you are either first available to enroll or when your group coverage is ending. For people that missed their initial enrollment period, there is a period called general enrollment period that is every year from January to February. Yeah, I'm just going to leave that, just let that. There is a special enrollment period. We talked about that when you work past age 65. That is called a special enrollment period. So you have 8 months after your group plan would end to enroll in a Medicare Part A or Part B plan. And you can wait those 8 months, but I wouldn't do that because as you look at the slide, Part C and D, you only have 2 months to enroll in. So if you wait until 8 months, you've missed your C and D because you need A and B to join a C and D. Okay. There are late enrollment premium penalties. Most people, like we said, there's no premium for Part A for the most part. So the penalty doesn't come into play very often. Part B, unless if you enroll late, unless you have a special enrollment period, you will have a 10% monthly, a penalty that's 10% of your monthly Part B for every 12 months that you didn't enroll. And this penalty never goes away. Sometimes people think, oh, just be for a year or so. Nope. It lasts forever Part D also has a penalty. That's an additional 1% of the average Part D premium, and that also never goes away. So now let's just say I've already got coverage and I want to change my coverage. When can I change my coverage? And the most notable time is called AEP. And sometimes people call it open enrollment, but this is the time that you get inundated with TV commercials. You get inundated with mail, with phone calls, because this is the time of year when you can make changes to your plan. So you can switch, drop your Medicare Part A, you can switch your Medicare Part D, you can go back to original Medicare, you can go to Medicare Advantage, you can go back, vice versa. You can switch from one Medicare Advantage plan to another. And this is the time of year that we as agents get super busy because we, by this time, have been introduced to all the plan changes for the year. So it is the time of year when you need to see your broker, your agent, and make certain that the plan that you have is still the plan that you want. Particularly important for your medications, and it's going to be particularly important this year. Don't assume that because you had a plan that worked good for you last year, that it's going to work good for you again this year. That may not be, and particularly with medications, and I'm assuming that this is probably particularly important with people with Parkinson's, that your meds, make certain you check that every year, and in particular this year. Another one that people don't really know is that there is a Medicare Advantage plan open enrollment. This is purely for people who only have Medicare Advantage plans. You can make changes during this time. We talked about the delaying your Part A and B. If you still have group coverage, that's a special enrollment period. Another special enrollment period that I see kind of often is typically when people move. You could be leaving your retiree plan or COBRA, but lots of times people move. We have people that when they move from Florida to Minnesota, for instance, they need a new plan. So they have a special enrollment period. There are lots of financial assistance programs out for people. There's help with Medicare Part D costs. There's Medicaid available, Minnesota Medicare medical assistance. There are Medicare savings programs out to help people pay with their Part A and Part B. There is a program called PACE that helps frail elderly people living in a community. If you want to know more about this, your state SHIP office is a great resource. They are very versed in all of these plans. Another one is your, oh heavens, I'm drawing a blank right now. So let's just, the senior linkage line, also super helpful. There's more resources on Medicare.gov. They also have a tool that you can go in and find of the plans available to you. I will tell you this much, it's not my favorite place to go because I found that it's not always as accurate as going to the carrier's direct, but you can go to Medicare.gov. You can call Medicare at 1-800, your SHIP program. You can talk to your local Social Security office. And now I promised I would tell you a little bit about the changes for 2025. The big change for 2025 is that that out-of-pocket drug costs are going to be capped at $2,000. So that's a big deal. It's going to be really helpful for a lot of people. In the past, those out-of-pocket costs maybe were capped at $8,000, $5,000, $4,000. This year it's going to be capped at $2,000. So it means that once someone has spent $2,000 on their drug costs, they will no longer be responsible for any more costs. But that's going to affect plans someplace that cost is going to have to be spread around among people. So what we expect for this year is that premiums will go up. We expect that there'll probably be fewer plan choices. We expect that the formularies will be more restrictive. Right now, Medicare says that you have to cover, every plan has to cover all of the categories of drugs with at least two medications. Many plans have 5 or more. We're expecting that they're going to restrict that. We expect that there's going to be more drug utilization management. What that really means is that you probably, maybe your doctor thinks you should have a brand name drug, but your insurance company says, nah, you're gonna have to fail the generic before we're going to approve the brand. We expect that probably, we said Medicare Advantage has some extra benefits. We expect that maybe some of those will be cut back. Right now, these are expectations. We'll know later this fall all the consequences of the changes. And this is where I want to tell you that please this year, make certain that you check your drug plans with an agent like me. The agent that you're working with is going to be more important than ever, that you make certain that your drugs are covered so that you are best taken care of. Also, beginning 2025, there will be a way for people to pay for their prescription drugs, easy for me to say, in monthly installments. So you guys, I know I went through that pretty fast and covered a lot of territory, but thank you so much. Please know that you could reach out to me. I love helping people understand Medicare, and I could, when I sit down with people, I can go in all the nuances and actually explain things to you. So thank you so very much.
Renee, thank you for that excellent presentation. You covered a ton,
I did.
very short period of time. Certainly underscore the need for professionals like yourself to help people navigate their way through these choppy waters, if you would. I think we do have some time for a couple of questions. Let me just check to be sure. Yeah. So, you know, we received an overwhelming amount of questions asking how to clarify how Medicare supports the care for people with Parkinson's. Can you just elaborate on that a little bit with somebody living with Parkinson's specifically in mind?
Yes, I will try to address that to the best of my ability. So Medicare covers, like we said, any medically necessary services. So Parkinson's, people with Parkinson's, I'm certain have particular diagnoses that are unique to them. Medicare will cover those medically necessary services needs the same way really that they would with any disease that someone might have. So they look at specifically, for instance, an example is the what is it? Is it called
brain
brain
stimulation.
stimulation? It particularly covers that, that service. It particularly looks at Medicare, at medications that people with Parkinson's might specifically have. There is not, I hope I'm making sense, there's not a particular plan that would be particularly designed for Parkinson's, but Medicare looks at all the needs of people with Parkinson's and says, what are the services that you need? And then they cover them.
Gotcha.
Does that make sense? I hope.
It does. And thank you specifically for mentioning the DBS, because I've seen a couple of questions on that in particular. You talked about Medicare and medically necessary treatment, and I think you may have covered this in your presentation, but if just to be sure, does Medicare cover physical therapy and speech and language therapy? Those are often prescribed for people with Parkinson's.
Yes, it does. So Medicare Part A covers PT when you're in inpatient hospital. It will cover it in an inpatient rehab facility. So it covers both physical therapy, speech therapy, and occupational therapy. And it covers it differently, but it covers it both on Part A and Part B. So if you're an inpatient, you will have coverage for all three of those. If you are an outpatient, you will have coverage for all three of those. Now, mind you, there are some additional requirements around that, but there's definitely coverage for speech and occupational therapy. Yes, don't be worried about that. It does a really pretty darn good job of covering those. You do have to always be, a doctor has to say that it's necessary, that prescribe it, okay? And so, there's some other nuances around that, but it's definitely covered both places, A and B.
What about assistive devices like wheelchairs and walkers and things like that?
They are also covered, and the caveat about that would just be that durable medical is covered. It needs to, again, have a doctor say that you need it, and you need to receive that from a Medicare approved vendor. But it is definitely covered, and yes, again, it just needs to be approved and a vendor, but there's definitely coverage for all kinds of what's the word I'm looking for? The the durable medical, that's the word I was looking for.
Wow. I think that that's probably all the time that we have for today. If you do have questions, please don't hesitate to reach out to Renee. And you know, her email is in the website, or to reach out to the helpline, the Parkinson's Foundation helpline. You can reach that at 1-800, the number 4 PD info.
Thank you so much.
I hope that this has served as a great resource for thinking about Medicare and the rights and benefits available, and particularly for people living with Parkinson's disease. Again, I'd like to thank the Parkinson's Foundation for making this webinar possible, and to Renee Harberts for her wonderful presentation. Also, thanks to each of you for taking time out of your day to join us today. Krista, I'll turn it back to you.
Thank you, Jim, and thank you, Renee, for your time today. If you would like to include the Parkinson's Foundation in your estate plans, we hope you share this intent with the foundation. To do so, if you have any questions regarding this process, please email us at legacy@parkinson.org. The Parkinson's Foundation provides weekly education and wellness programs virtually through our PD Health at Home series, including Mindfulness Mondays, Wellness Wednesdays, Fitness Fridays, our expert briefings, and our Spanish language programming, Ipi Salud en Casa. Find out more and register for our PD Health at Home programs at parkinson.org/pdhealth. Please do not hesitate to reach out to the Parkinson's Foundation. We have a comprehensive website and many more resources that address everything related to PD at parkinson.org, or you can call our helpline again, as Jim alluded to, which is staffed by Parkinson's specialists. That number is 1-800-4PD-INFO. Alternatively, you can email us at helpline@parkinson.org. We'll see you all again soon here in Zoom land. Until then, be well.